I'm Min Sun-hee. Starting from today, that is this Wednesday, all those choosing to ride the subway during peak hours are required to wear face masks. And for more on that, we have our Kwon Soa and Noah Ram here in the studio. Welcome.
Hi.
Hi.
So let's start with the domestic updates before we touch upon the face masks.
Well, most of our new cases reported this Wednesday were again related to the Itaewon clubber case. That is why the country is really focusing now on epidemiological investigation to detect new transmissions as fast as possible. And amid thousands of people potentially exposed to the virus. According to Seoul Mayor Park Won-soon earlier this morning, a total of 119 COVID-19 cases were linked to the Itaewon case as of 10 a.m., with 69 of them being patients from Seoul. More than 14,000 people have been tested for the virus, he said, but still many have not. With Park again stressing there is no time to hesitate. Seoul's Yongsan-gu district, where Itaewon is located, has set up more testing facilities, such as walk-through testing sites. Officials, meanwhile, continue to emphasize that the identities of people getting tested in relation to the Itaewon case will be kept anonymous. Secondary and tertiary infections are a big concern. In one case, a cram school teacher in Incheon is said to have spread the virus to 8 people, including middle and high school students, after visiting one of the Itaewon clubs. And the concern is now that 2 students out of these 8 students visited churches over the weekend, which means more contact tracing. And I don't know if you guys received that text message this morning, but this Wednesday, an English language text message was also sent out, giving out notice to foreigners that free COVID-19 screening for Itaewon Club visitors is available at screening centers. And of course, that given that Itaewon district is a really multicultural district.
I actually did get that message. So with the recent outbreak, we are nearing close to 11,000 cases.
Right. To be exact, we have a confirmed number of cases at 10,962. We will see our table now with 26 new cases added, and 21 are related to the Itaewon case. Meanwhile, we have another death reported, this time from Seoul. Now, Seoul has 3 deaths in total now from the virus, and the latest was an 82-year-old man who recovered from the virus but later died of a different illness. He did not have an existing health condition but is still categorized as a COVID-19 related death. And we have the same number, 1,008 people still in quarantine, just like yesterday. And if we go over to our map, a dozen new cases have occurred in the capital Seoul and 2 in Gyeonggi-do province. Now, Gyeonggi-do province and Seoul have now more than 700 cases in total. We also have 2 cases in nearby Incheon and 3 down south in Busan, and 4 cases were imported cases.
Right, let's move on to the global updates. We connect to a resident in Brazil later, where cases are surging, Soa.
Yes, Brazil has become one of the latest hotspots of the coronavirus in South America. The country has recorded its deadliest day since the outbreak of COVID-19 on Tuesday, with 881 fatalities. That is, the total number of confirmed cases surpassed 177,000. Despite the continuous rise, Brazil's President Jair Bolsonaro is being criticized for downplaying risks of the virus and for exempting certain businesses from lockdowns, despite state governors saying otherwise. His argument is that the economic damage is worse than the pandemic itself. Brazil, meanwhile, conducted 338,000 coronavirus tests in the past 3 months as of Monday. Germany, which has a similar total number of coronavirus cases, tested 330,000 last week alone. There are predictions Brazil's death toll could reach over 88,000 by August.
And speaking of the death toll, there are doubts about the accuracy in such tolls in the UK and Russia as well.
Yes, especially in Russia, the low fatality rate is quite puzzling. Russia has reported around 13 deaths per million, with the latest death toll at 2,116, and the global average is 36 deaths per million. Experts are suspecting that government authorities in Moscow, which is the epicenter of the virus in Russia, may be underreporting the number of deaths. But officials insisted that the country's mass testing is responsible for the low fatality rate. Meanwhile, the United Kingdom's real death toll, according to recent analyses, has already exceeded 40,000. This figure being the result of latest data compiled from separate regions, such as the National Records of Scotland, the Northern Ireland Statistics and Research Agency, and others. Now, let's take a look at the tallies around the world. Despite potential inaccuracies, depending on how countries count these numbers, we have 1.4 million total confirmed cases in the U.S. with more than 83,000 deaths, and Russia now has a total of more than 230,200 cases, while Brazil, which we talked about before, surpassed Germany in total cases and is now close to France. And those are the global updates.
All right, so thank you for that. I'll come back to you after the regular briefing. Yes. Meanwhile, Aram, it's been a week since the Itaewon outbreak, and many are calling this period a critical moment.
That's right. We've already seen a spike in new cases from the single digits and, as I mentioned, in the mid-20s now. And health authorities are saying that if they're able to find at least 90% of suspected patients linked to this Itaewon case, then there is a chance to stop a second major outbreak. So it is a race against the clock at the moment. Korea CDC says it is a matter of time to find everyone who was in Itaewon in late April and early May, and says this week will prove crucial in trying to curb the further spread of COVID-19. The government is tracking down those who were there and still urging suspected patients to come forward, guaranteeing anonymity, because that is a concern of why people are keeping quiet at the moment. Particularly, the government is trying to find those who were at the affected facilities last Tuesday and Wednesday, the last days of the Golden Week holiday, as that was when the so-called Itaewon super spreader went clubbing. And if anybody was in contact with him and were infected, then they would have started to show symptoms by now, during the past week, in fact. So hopefully the government will be able to track them down. And authorities have a tough task ahead of them, however, as many people have been unwilling to come forward for testing, especially after the Itaewon Club have faced some criticism online as well.
Right. Social distancing guidelines have been eased in Korea, but given the Itaewon outbreak, I understand stricter measures are being enforced once again, especially in public transportation.
Yes, just as you mentioned in your opening, subway passengers in Seoul are required to wear face masks during crowded hours, rush hours, and the rule started today, in fact, and people without masks will not be allowed to board subways, trains when the train capacity to passenger ratio reaches 150%, which is almost always the case during the rush hour peak hours. And the Seoul City government will also operate more subway trains during the rush hour to avoid congestion, and those without masks will be able to purchase them through vending machines and convenience stores at stations, so they are readily available for purchase. Safety personnel will also be dispatched to notoriously congested stations, namely Gangnam and Hongik University stations on Line 2 from next month, to make sure people are keeping a safe distance from each other while waiting for the trains. Now, if trains get too crowded, then staff may restrict boardings, and some trains may even skip stations and not stop at them. And service announcements will be made in these cases, so people will be notified. Meanwhile, bus operations returned to normal today as well, and they were reduced amid the peak of the virus outbreak, but now they're back on track.
I think I might have been the only one who took the subway this morning, but I actually realized that they made those announcements over speakers this morning regarding the face masks. So I looked around in the subway and there was really no one who did not wear a mask. So I think that's the reason why we do not have these cluster infections at subways yet.
And hopefully it will be the case in the future as well. Diplomatic efforts, Adam, to fight COVID-19 are continuing, and a group led by Korea has been launched in the UN.
That's right. The Seoul unveiled the plan last week to launch the so-called Friends Group in the United Nations in order to further spur global discussions on battling the pandemic. And now it held its first video conference on Tuesday, which was joined by some 200 officials and health experts from some 30 countries. And it was also attended by Seoul's Foreign Minister Kang Kyung-hwa. The meeting was co-chaired by Korea, Canada, Denmark, Sierra Leone and Qatar. Kang expressed hope that the group will make substantial contributions to the global fight against the pandemic. She was also optimistic that despite the Itaewon case, the overall spread of COVID-19 has tapered off in Korea. And the UN Friends Group also hopes to serve as a platform to discuss international security challenges as well, stemming from the virus. And Seoul is also planning to launch 2 other cooperation groups with the WHO and UNESCO later this month.
Oh, I see. All right, Adam, thank you for that. We'll see you again tomorrow. We turn now to the regular briefing on the COVID-19 situation in Korea. Officials here are working around the clock to track down some 2,000 people who were at Seoul's Itaewon district from late April to early May. Mobile carriers, credit card firms and closed-circuit footage have been providing authorities with relevant information to facilitate the task of tracing about 10,900 people who were in the area during that given period. Now, just as I mentioned, from that number, some 2,000 have yet to be reached. Now, the tests, meanwhile, can be taken anonymously, free of charge, and test takers need not explain their reasons for taking them. The new cluster infection in Itaewon is already giving rise to secondary transmissions, while healthcare officials have also confirmed a separate case in yet another popular nightlife district, Hongdae, that is the area around Hongik University. The fresh plea from the government now is that a day of hesitation on your part to get tested can result in a month's halt of activities in society. Here now is the briefing. We'll come back to you afterwards. Well, we've just had the briefing has yet to start. So what we'll do right now is perhaps take a look at the updates for the figures for... Oh no, the briefing has started. We'll come back to you afterwards.
First, here is Chung Eun-kyung with the briefing. Let us now begin our regular briefing for today on the coronavirus outbreak. And as of May 13th, Wednesday, today midnight, we have 26 new patients and the total number of confirmed cases stands at 10,962. 25 more people have been fully recovered and a total of 9,695 have been discharged. And a total of 1,008 people are still in quarantine. And yesterday we had one additional fatality with the death toll now standing at 259. I extend my deepest condolences to the deceased and the members of the bereaved families. And as of today midnight, we have 26 new cases, and 4 of them were imported cases, while 22 were community transmissions. And out of the imported cases, 1 was from Americas, from Bangladesh, Japan, Kuwait, had 1 respectively. And also as for the 22 community transmissions, among them relating to the club cluster infection, 18 were related to that. And 2 were related to Daegu, and 2 in Incheon community transmissions. And in Daegu, out of the 2, 1 of them were it was confirmed before the screening testing that was carried out by the senior job-related outbreak. And as for the Incheon outbreak, we are still doing the epidemiological investigations. And out of the 18 newly infected cases of the clubs, 8 were visitors, and also the 10 others were the contacts of the people who have been confirmed. And as of today, and as of noon today, we have 8 more cases. So a total of, in relation to the Itaewon Club, we have 119 patients so far. Especially in Incheon, we have confirmed that 8 of the confirmed cases has been infected from 1 clubber who went to the Itaewon area after being tested positive. And in Seoul we have 12, and also we also have 4 in Busan, 1 in Gyeongbuk, and Jeju has 1. And out of the 5 in Chungbuk area, 4 of them are also from the isolation facility of the National Defense Ministry. And as for the sources of infection, 76 were the visitors to the Itaewon Club, and also the families, the friends and the acquaintances were 43, and by age those under 19 were 11, and this also includes those students in Incheon area who have been infected, and 73 are 20s, and 21 Itaewon are 30s, in their 30s, and also we have 3 people in 60s, and 102 people are male, while 17 are female. And KCDC would like to ask anyone who visited any of the nightlife entertainment venues in Itaewon area, including any clubs or bars, from 24th of April to May 6th, to stay home and refrain from going to other places, and to visit a screening clinic and get tested as soon as possible, regardless of symptoms. And we also urge the municipal governments and healthcare institutions and screening clinics to actively help such people get tested regardless of their symptoms. In order to alleviate any concerns on the issue of privacy, we carry out these testings anonymously. And as for the movement traces of these confirmed cases, we will be disclosing them in a separate route. So we have amended our guidelines for the disclosure of such movement traces, and we are seeing an increase in the cluster infections, and we believe that identifying the patients at an early stage is very important. So we ask the members of the public to carefully follow the 5 infection prevention rules, including washing of your hands, and we also ask you to refrain from going to crowded spaces like clubs and bars. Moreover, if you have symptoms like fever and other respiratory symptoms, please stay home. And if you have aggravating respiratory symptoms, please get screening at the screening centers. And especially if you see more than 2 people get confirmed within your family or your community, you need to also get tested as well. And the cluster infection that started in Itaewon Club also is leading to increased number of confirmed cases due to voluntary participation in the screening testings. And up to now, 22,000 people have been tested, and we have 119 tested positive from the Itaewon case. And we are also seeing an increase in the secondary infection as well, ranging from age of 1 to age of 80s. And also they range from close family members, from nieces and brothers, and as well as grandparents as well. And as one becomes hesitant, we believe that we will have more damages, as the virus would lead to secondary and even tertiary infection. So we would like to identify the patients at an early stage through the voluntary participation in the screening process. So this is the most effective method. Many of the people are getting voluntary testings. However, there are still many people who are refraining from getting the testings, as they are scared and concerned of the discrimination and criticisms. Therefore, we would like to urge the public to refrain from discriminating and condemning these people, and this hinders our quarantine efforts. And the quarantine authorities highlights the importance of protecting our individuals and community, and thus we will continue to protect one's privacy as well as personal information in the process of screening testings. So we have a message to those who have been in the Itaewon region during this specific time. Many of you could believe that you are okay because you are healthy and young, and you are afraid to get tested because of the prejudice by the society. However, our message is very clear, and we have said this multiple times. The virus is very deadly. When you are infected, you could incur much damages to your close loved ones. And when this leads to secondary or even tertiary infection, you could also do big harm to the society as a whole. So you need to be responsible for as an individual and get tested as soon as possible. Thank you very much.
Right, that was Chung Eun-kyung, the head of KCDC, with the latest on the COVID-19 situation here in this part of the world. So do give us a summary of the key announcements.
All right, we had 22 out of 26 new cases that were community spreads, according to Jung Eun-kyung, the chief of the KCDC, with the majority related to the Itaewon case. And the 4 imported cases, she said, were from America, Bangladesh, Japan, and Kuwait. And she stressed that there is a big concern regarding secondary infections stemming from this Itaewon case. Especially today, we're seeing actually a higher number that accounted to secondary infections than actually people who were at those clubs. So even there are students that had contact with a teacher in Incheon who was at the club in Itaewon, and the age range is very broad, from 1 to the 80s of when it comes to these secondary infections. So that is why Tong stressed that people should go to voluntary testings. In fact, 22,000 people already tested for the virus, but there are still many who are refraining from going to the screening testing sites. So she had a message to the people who were in Itaewon region, stressing that the virus is deadly and these people could contract the virus to close people, families, or acquaintances.
Right, Swa, thank you for that. We'll see you again tomorrow.
Thank you.
Brazil has now become the 6th country to see its COVID-19 death toll cross the 10,000 mark, and a 3-day period of national mourning was observed this past weekend. Brazil was also the largest importer of Korean test kits in the month of April. And for more on the latest there, I have Kim Mi-jung, a Korean national and restaurant owner in Sao Paulo. Hello, Mi-jung.
Hi.
Mi-jung, let's begin with the public atmosphere in Brazil given this very difficult period.
Well, actually, we see the numbers growing in deaths and the confirmed cases. However, we don't really talk much about the numbers going up. It's much more about what are we going to do about it now. They're just demanding more answers. People are just worried about their situation and what's going to happen in the future more than discussing the numbers going up.
Mi-jung, I understand that you are a restaurant owner there, and how is your business and perhaps similar enterprises being affected by the pandemic right now?
So my business, it's a very small restaurant, so I wasn't affected a lot because I don't have a lot of employees. However, now I have to do everything by myself. Of course, the sales have gone maybe more than 50, 60% down. And there are lots of competition because we only do deliveries and takeaways. However, now even the 5-star restaurants or the hotels are even delivering. So I have competition. They're trying to survive. And not me, just other people. Officially, 10% has closed. But now, knowing from the inside, the restaurant owners, about 20% will be closing, and about 1 million people have lost their jobs until now.
That is quite alarming. Mi-jung, tell us a bit about the lockdown measures being imposed to contain the virus in Brazil.
So lockdown started end of March, but there wasn't any enforcement really on the lockdown. The companies actually were the ones that said, stay home, do this home office, and the government said everything shut down except the restaurants and pharmacies, but there wasn't any kind of, really serious measures going on. Until last week, they found out that less than 50% was actually complying to the quarantine. So then they were trying to enforce more lockdown by controlling the traffic and everything, but it just didn't really work. They canceled one of the systems that they implemented in one day. Now, since 2 days ago, they started rotating the cars to enforce this lockdown. However, it increased the number on the public transportation. So there's just a chaos going on here.
I see. Which is why there are concerns that the pandemic could lead to a collapse in Brazil's economy, with the cabinet official there warning of an impending food shortage while calls mount for the president's impeachment. Mi-jung, what is the public stance on the country's current state of affairs?
So I think the anger towards the government is just growing and growing. Every day, 8:30 p.m., there's just a strike with people on their balconies and windows with their hands, saying, "Fora Bolsonaro, go out Bolsonaro," because he's saying that it's just like a little flu and when people are dying and this lockdown, he doesn't think this is serious. So there's a clash between the government and people are talking more about the political stuff more than the actual situation. And actually, Brazil it's a complex economy because there's just a huge gap between the really rich and the poor. So people don't have answers. They're just in a very mental breakdown situation. But Brazil has already was going through a crisis, and now an even worse crisis came. So people are just without answers.
Major, one final question. As I mentioned earlier, Brazil was the #1 importer of Korean-made test kits in April. Do you believe this is a reflection, perhaps, of Brazil's high level of faith and confidence in Korea's strategy against COVID-19?
Brazil definitely has a very, very good confidence for Korean test kits and how we did the system. However, that is never going to be implemented here, and the citizens know that. We have the kits from China, Korea, but then there's just fake news going on saying the kits from China or Korea, they're fake, they're not working. And so we really don't know which news to look for. And actually test kits here, it's not free. It's about $50, $50 to $100 US dollars to get tested. But it's because of the currency that it just doesn't sound so expensive. For Brazilians, it's a high, it's very costly, so people don't get tested. And of course, yes, confidence for Korea is high. We talk about it. My friends share Facebook information about Korean articles, but it's just like a very idealistic situation for them, and they know that it's not going to happen in Brazil.
All right, Mi-jung, hopefully that will change in the future. Thank you very much for making the time to join us live at this hour.
Thank you very much.
시스템 반도체, 바이오 헬스, 미래차 등 3대 신성장 산업을 더욱 강력히 육성하여 선도형 경제로 포스트 코로나 시대를 개척하겠습니다.
Now, in an address to mark his third year in office, President Moon Jae-in this past Sunday vowed to ease the economic fallout amid COVID-19 by fostering new growth engines based on non-face-to-face interactions. Now, this also includes providing healthcare services virtually. For more on the feasibility of this initiative, I have Professor Chung Hyung-sun from Yonsei University. Welcome, Professor Chung.
Thank you.
And I also have Professor Park Jung-min from Hanyang University. Welcome to the show.
Thank you, friendly.
Professor Chung, we'll start with you. President Moon Jae-in has announced plans to revamp the nation's quarantine system. He is calling for the restructuring of the Korea Centers for Disease Control and Prevention to a full-fledged independent government agency rather than an affiliate association of the Ministry of Health and Welfare. What meaning does this plan have?
Yeah, in fact, the 2015 MERS experience was the biggest help in the government response to the current COVID-19. Since the MERS incident, the head of KCDC has already been upgraded from the first level official to the vice minister level. Now, it is unclear how much professionalism will increase even if the name of KCDC is changed from headquarters to the agency. It is true that people say that the independent operation is important, but in fact, it is unclear whether KCDC operating independently from the Ministry of Health is an advantage or disadvantage for infection control purpose. It is clear that KCDC responded quite well in this COVID-19 situation, and it is worthy of praise. Another important advantage is that the public health insurance scheme supported it. That is, the information of each patient could be provided in real time from the big data of the National Health Insurance, and that the patient's flow and move could be identified through the health insurance DUR system, drug utilization review system. Anyway, it is expected that there will be a big change as the president himself directly mentioned the plan to advance the national contagion prevention system.
Professor Park, given the possibility of a second wave of infections in light of the Itaewon outbreak, I'm assuming that healthcare workers are on high alert now.
Yes, even before these cases happen, many experts said that we have a second wave of COVID-19 viruses. So the President Moon announced that already about the Center for Disease Control and Prevention will be elevated as administration for the protection of COVID-19.
I see. Now, before we continue with the studio discussion, let's take a moment to listen to the thoughts of another pundit in the field. I have Dr. Sirina Kasara live on the line from Stanford University. Welcome to the program, Dr. Kasaran.
Hi, how are you?
Fine, thank you. Thank you for joining us today.
Thanks for having me.
Doctor, how would you assess the current state of the American healthcare system amid efforts to fight COVID-19?
That's a loaded question. So I think that there's two stories really going on here. One is the story of New York, where they really are stressed. They have a ton of patients and really not able, well, they're doing their best to handle the outbreak. And then the other is the rural situation where they have had to shut down their surgeries and their elective cases and move everything to telemedicine. And the surgeries and the elective cases and the outpatient service lines are where they really get their financial support. So because these hospitals are empty, they're really not able to survive financially and are having to lay off and downsize a lot of their healthcare service force. So I think that it's two stories and it's still evolving, and we're going to have to see what happens. But in any situation, the entire healthcare system is going to transform, as we're already seeing.
Dr. Kisara, here in Korea, healthcare workers are bracing for a possible second wave as quite a number of young people have been infected at a popular nightlife district in Seoul. What are your thoughts on the risk of young people becoming super spreaders of the virus?
Yeah, so I don't know if they're super spreaders, but they're definitely silent spreaders. So the issue, for example, I'm an OB-GYN. I take care of pregnant patients on labor and delivery, and we've been testing all pregnant ladies who come onto labor and delivery with a rapid test, and we're seeing completely asymptomatic, young, healthy patients with the disease. And so we're having to use the complete PPE and precautions because of that. And so, you know, we don't exactly know the biology of this virus yet, but they say about 25% of carriers can be asymptomatic. And it seems like the young people are the ones who are going to be carrying that around without knowing it.
In a paper you recently published, you claim that the existing medical infrastructure is mostly analog-based and thus unsuitable to properly tackle COVID-19. What can you tell us about the need for telemedicine in this regard?
Yeah, so many different industries like banking and retail has switched over to digital mechanisms that healthcare just hasn't done yet because we are used to the way of practicing, and COVID is really forcing us into this new era. I think it's showed us that the healthcare system, bringing everybody into the clinic or into the hospital, can actually put people in danger. And what I'm seeing in my clinics that are using telemedicine, people are better able to access visits and don't have transportation barriers, childcare barriers, sick barriers, and so they're able to get care much more easily. Now, it doesn't mean that every single visit needs to be telemedicine. There's certainly definitely a role for in-person visits, but it's just another way to expand the access.
What measures do you suppose need to be in place to establish the necessary foundation for the wide adoption of telemedicine then?
Yeah, so I think number one thing is the policy in the US. You need to have the payment structures that allow for telemedicine to be reimbursed appropriately. Then you need to have the infrastructure, the internet capability, and then you have to have the providers and patients be open to receiving care in this way. But honestly, I think in the world that we're in today, people are very open to that. So it's really the infrastructure and the policy.
All right, Dr. Kisara, thank you very much for your thoughts and time.
Yeah, no problem.
Professor Chung, turning our attention to the country here then, how far has Korea come in adopting telemedicine?
First of all, as Dr. Kiara said, the most important thing is the healthcare system is divided into two systems, financing and delivery. And she said delivery payment system is very important, but in the case of Korea, the public health insurance is ready to pay for telemedicine, but the problem lies in the delivery system. That means medical law prohibits telemedicine between doctors and healthcare professionals, including nurses, are already allowed in 2002, but currently direct face-to-face communication between doctors and patient is not allowed, is illegal currently. So some efforts to revise this situation has been tried for the last 2 decades. It has failed. The current corona incident temporarily allowed medical consultations and drug prescriptions over the phone, and the emergence of some medical institutions that accepted government policies has quickly increased the social interest in telemedicine. That's the situation, I think.
Professor Park, there has been much debate on telemedicine. What are some of the key arguments between the proponents and opponents?
Actually, we have enough infra to service telemedicine right now because we have a very good internet, something like that services. However, there are some issues regarding adopting telemedicine, especially like misdiagnosis by the doctors, because doctors need to see the patient directly. So they have more chance to have misdiagnosis when they do not see the patients. However, thus currently right now, we have very limited service in telemedicine right now.
What is your personal stance on telemedicine?
Actually, there is a good way to using telemedicine right now. The first one is people live in rural area. They are more poor accessibility in the healthcare system right now. So if they want to go to hospital and then they need to go to transportation very long time. So if we adopted telemedicine that time, we can provide a high quality healthcare service. And the second one is patient go to hospital and they are waiting just 2 to 3 hours to meet the doctors right now. So, but the doctor meet is only like 1 to 2 minutes right now. So if you use telemedicine system, we can do like reduce their time and then we can save their times right now. However, there are some issues regarding like misdiagnosis by the doctors. So it is really important to manage that side effect.
Professor Chung, where do you stand on this matter?
The issues raised as a problem of telemedicine is patient safety and medical commercialization, and patient move from clinic to big, large hospitals. Those problems are all issues that should be sufficiently considered while setting the details of telemedicine system. However, the current situation in which non-face-to-face treatment is illegal and the access to medical care for the vulnerable is limited should be solved immediately. Amendments to the current medical law are urgent in this sense, I think.
Right, I see. Non-face-to-face medical services may become the new norm in a post-pandemic era, that is. In this next video, we take a look at some changes that are already taking place at a hospital in Seoul.
Amid the COVID-19 pandemic, hospitals have taken stringent quarantine measures with strict access controls in place from the very moment people arrive at the front entrances.
병원 입구에서 오시는 환자분들의 체온을 측정하고 이 환자분들이 코로나19 감염자분들과 겹치는 동선을 갔다 오시지 않았는지를 확인하고 있습니다.
Twice a day, the hospitals thoroughly clean and disinfect all surfaces that have come into human contact in offices and patient rooms all throughout the facility.
이런 사회적 거리가 길어지고 있기 때문에 환자들의 공백을 메우기 위해서 국가에서는 이제 국민 안심병원이라는 것을 운영하고 있습니다. 저희 병원을 운영하고 있는데요. 이 안심병원이라는 것은 호흡기 질환 환자들과 비호흡기 질환 환자들의 동선을 철저하게 분리를 해서 원내 감염이라든지 교차 감염들을 방지를 해서 환자분들이 좀 더 안심하고 안전된 병원에서 치료할 수 있도록 한 시스템을 운영하고 있습니다.
The quarantine measures adopted by hospitals in Korea have also been well received by foreign patients.
The hospital system, at the first time I was astonished what I should do here, but I think it's a very good, a very clear way, yes, and it's a way of responsibility against all us people.
Our hospital is very concerned about the safety of the personnel, but also the safety of the patients. So we have very strict measurements in order to prevent any outbreak in our hospital. And actually the patients are very satisfied with those kind of measurements. Yeah? They comply with them. So I think also the patients feel very safe in our hospital.
Amid the COVID-19 pandemic, many changes have taken place in hospitals nationwide. Vehicle solution test centers have been introduced to lower the infection risk among medical workers. Countries around the world are also emulating Korea's testing methods, breaking the existing norm of doctors and patients sitting across from one another in a room setting. Artificial intelligence has also been employed, such as robots that disinfect patient rooms using eco-friendly ultraviolet LED sterilizers. Robots also move up and down the hallways to transport various medical supplies needed for diagnosis and treatment. These medical robots not only assist healthcare workers in disinfection and quarantine, but they also help to lower overall infection risks and will likely see a more widespread adoption in the coming years.
의료진들 같은 경우는 이제 감염 위험에서 최대한 이제 위험을 경감시켜 줘야 되기 때문에 비대면 서비스가 이제 가능한 솔루션 같은 경우는 일정 부분 의료진들의 과부하를 일정 부분 대체시켜 줄 수 있지 않을까라고 생각하고 있고요.
As we enter a new normal period in our everyday lives, where quarantine rules have become a part of our daily routines, Korea's medical scene is also undergoing profound changes with the help of many innovative ideas.
Professor Chung, in neighboring Japan, telemedicine is being used by first-time patients, and there is even home delivery options for prescription drugs available. How long will it take for Korea, perhaps, to reach the same level of application?
Yeah, in Japan, exceptional non-face-to-face medical treatment has been allowed for more than a decade. And 5 years ago, since 2015, public health insurance has covered non-face-to-face care in the name of online care, online health care. In Korean case, I think it would be better to firstly allow a non-face-to-face care only for patients who previously had face-to-face treatment for the safety, and then expand it to other cases as experience gains.
So in a gradual manner.
Gradual manner, yes, right.
Professor Park, you mentioned misdiagnosis as a potential danger of telemedicine. What are some ways, perhaps, of addressing this problem then?
Actually, the biggest issue using this digital healthcare system and the telemedicine is have like a misdiagnosis and then the patient privacy. But we have very good system in blockchain, because blockchain can be performed like patient privacy, protect to patient privacy, and then they can do like some kind of control the very sensitive healthcare information to doctors. So if the doctors share the information with the other doctors, and then we can protect the medical mistakes.
I see. All right, Professor Park and Professor Chung, thank you very much for your time today.
Thank you.
Right, and that is all the time we have for today. Do tune in tomorrow as we have scenes from the baseball season here in Korea, which has captivated sports fans both at home and abroad. In the meantime, do feel free to send your thoughts and inquiries through our social media accounts or homepage arirang.com. Thank you for watching.
Daily social distancing. The goal of daily social distancing is to prevent the spread of diseases